Awesome.
Did it.
Yay.
Yay.
Go, Kayti.
20 minutes of
First
trying,
time.
friends.
All right.
20 minutes. Okay, thank you for everyone who is still hanging on out there. We are so excited to have Dr. Bret and Dr. Renee, and we are going to start. Oh, Kim, thank you. We are finally ready to start this interview. Thank you, Dr. Bret and Dr. Renee, for believing in me and thinking we could make this happen. All right, we're here. Whew.
Great.
Okay.
Awesome.
So let's start all over again. I'm going to make a short intro and say, Dr. Bret and Dr. Renee, you know, I invited you here because I was so blown away by what you do for families. And from there, I will just let you guys start talking.
Great. Okay. Well, I'm Dr. Bret Gerber. I'm a pediatrician here in town, a medical doctor, and I've been practicing pediatrics for 30 years. And have started Pacific Integrative Pediatric Health with my partner here, Dr. Renee. And we are so excited to be on your call, Kayti. It's been great to get to know you a little bit over the last couple of weeks, and excited to be on your interview. I'll let Dr. Renee introduce herself, and then we'll go and tell you more about what we're offering, what's going on over at PIPH.
Thank you so much for having me. Also, I'm Dr. Renee McLeod, and I'm a pediatric nurse practitioner. I've been a pediatric nurse practitioner for over 40 years, most of it since 1991 here in San Diego. And before that, really traveling the world, practicing with my husband, who was in the Navy. And so we got a lot of experiences around the world, and that certainly influenced my exploration into other things besides traditional Western medicine care. And I'll let Dr. Bret tell you a little bit about integrative pediatrics and how we kind of started this practice together.
Right. Dr. Renee and I met back again a few years ago after I had trained under her actually through UCSD in my residency. And it was really an honor then and such a pleasure to meet her now coming back to integrative medicine. And that's a special thing that's really developing over the last few years. People know about complementary and alternative or CAM procedures or therapies. And integrative medicine takes the West and kind of joins it with a lot of the ancient traditions and other kinds of things that are out and available now to the community, way beyond just antibiotics and a lot of the Band-Aid medicine that we do in Western medicine. And both Dr. Renee and I think, got pretty frustrated with seeing more and more chronic illness in kids and a lot of you know, the 5-minute visits, here's your antibiotics or here's your prescription and come back if it doesn't work. And that just is not working for kids and families and all of us. So let me turn that ringer off. I got introduced to CAM back in the 90s in my medical school, where I was lucky enough to take a course actually, and we learned about qi and meridians and some acupuncture and acupressure points, biofeedback. We did some qi energy work, look at tongue diagnosis and pulse diagnosis, some of the ancient traditions that are 3,000 to 5,000 years old and are still practiced today in much of the world. And actually Dr. Renee does some Ayurvedic medicine herself. And I joined an integrative fellowship, an integrative medicine fellowship a couple of years ago. And I've learned a tremendous amount through that and a lot about herbs and things. And what brought me back to integrative medicine was chamomile tea, of all things. It's such a big thing now. We use chamomile in everything and drops for babies and things, but grandmothers were giving it to the kids that were colicky. And I listened and I saw the improvement, and all I had were antacids and PPIs and things to give kids, which had side effects, and the kids threw up and it just was miserable. And so chamomile tea just opened my eyes, because now 20 years later, we have evidence that chamomile tea is anti-inflammatory and has all these soothing qualities in the gut and in the brain and can help us sleep at night. And you know, now it's proven, even though it's been used for centuries in other practices. So that's really opened my eyes and got us to where we are today.
That's a great, chamomile tea is actually like still unknown to a lot of people for how great it is at soothing our nervous systems and our children's nervous systems. And I'm so glad you brought that up, because it's like you can get it for $1.50 even today at the grocery store. That's such a good, simple reminder.
And it's so simple and so natural no side effects unless you have an allergy maybe to the the flower, but it's a flower tea and it's got a nice flavor and it's really so simple.
Yeah.
I think I started going into integrative medicine really years of practicing traditional Western medicine. But when we started seeing 30 patients a day and just feeling like I never could make a change, I became a nurse practitioner because I was passionate about helping mothers raise children that were healthy, that had a healthy lifestyle with a focus on prevention for chronic disease rather than just constantly putting a Band-Aid on it, and really wanting to find the source of disease. And that became more and more apparent as children we started seeing more and more chronically ill children, was really wanting to go back to look at the source of disease, to really focus on prevention, and really to help families develop a very healthy lifestyle where what we do is really support the child, because your body wants to be healthy. Children grow up and their body wants to be healthy, but what we need to be doing is providing the support for them to do that in a world where everything is geared to helping them be unhealthy, where they're supersizing food and the commercials are really about staying on the screen and really living a very unhealthy lifestyle where they don't get exercise. And we wanted to focus back on that. Plus, I think we really wanted to put both the best of Eastern medicine and Eastern more traditional care and Western medicine under one roof, where we could create a new model for healthcare.
And so, Dr. Renee, that's totally why we're here for this call. I want to hear about the model that you guys have. I want everyone to hear about the model that y'all have. Can you start walking us through like the membership model and/or how it all works?
Bret?
Sure. Yeah, we've come together with a bunch of providers. So we have a naturopath and a DO who's not a DO here. She does manual therapy for us. She was trained in Europe.
What's manual therapy?
The osteopathy. So the manual therapy is using tissue release that's in the neck, or it's a craniosacral therapy, it's massage, it's doing a lot of deep tissue work where you may store things or bind up nerves, or there's it's decades of training. It's a lot like, it's what a DO does, a true trained osteopath. A lot of DOs go into allopathic medicine, which is your normal Western medicine, and don't continue their osteopathic training. And she's kind of done the opposite. She's given up the Western part and done just the osteopathy. So for constipation, she'll massage areas of the belly, up by the liver and over by the spleen. And she'll do other kinds of things that actually get the whole system working again and
That's what I want to know.
Kind of the kinks.
That's what we want to know, right?
We work on the whole body, right? And so we work with all of these people. We've got acupuncturists and Chinese medicine practitioners as well that we work with. And then we're getting tied in with the whole community with chiropractors and doulas and midwives and everybody. So we're bringing a lot of that together. And when we see a kid, usually we'll come together as a group and decide what the best therapies are, who's the best practitioner to see them next. So we bring you into our practice. We have what we call a membership model. So we do not take insurance at this time, and we're not planning on it. We do it where you can pay a membership, a monthly membership or an annual membership, and then you get to see all the providers. So you get to see the acupuncturist up to a certain amount of visits. We can't give you a price per person because it changes depending on how many kids are in the practice, but it starts about $250 for the first child if they're under 2, and then it goes down from there. So, and that's per month. You can do also visits, just individual visits. So if you have a pediatrician you like, who you can work with, then you can see our acupuncturist, our osteopath, and still get an intake with them, or see one of us kind of as a consultation, kind of as a subspecialist. And then what's also unique about our office is that we have a classroom where we can do yoga. We've got a kitchen where we can teach nutrition and cooking classes. We've got a salt room. So we've got all of these other aspects that become part of your membership. So you get some of those things with your membership to us, or you can come do just yoga with us if you want and buy a package of classes for that too. And it'll all be kid-based, but we of course work with the families. So we're going to offer parents, teaching them how to teach or to cook, because some of them don't know that. And then Dr. Renee does some things as well. I'll let her explain her healthy, happy mother baby, and her Dharma parenting. She's got some unique things also.
Yeah, I think that our goal, in addition to seeing everybody together, is to really focus on lifestyle and behavior changes to create health. And we see adults also, so those adults can come in to the other services. Brett and I are the only ones that only see children. Our other practitioners all see adults. And then again, you don't have to be a part of our membership practice to come in and come to a series of classes, or to come into the salt booth, or to take the cooking classes. But that is part of your membership. If you're a member of our practice, you get that as part of that. So that's this whole thing. We do have a couple of other services. One is the Happy Healthy Mother Baby. That's an Ayurvedic approach to delivery, and we really hope to start at preconception. And the goal is really to create an appropriate diet and environment for the ideal, so that the mother starts with the ideal environment to have a healthy baby throughout her pregnancy. This is an add-on to your OB care. So it would be very complementary to the midwives and to what you're already offering. It's not an instead of service. It's in addition to what you would already offer. A lot of it is with diet and massage and a very Ayurvedic approach. And then that goes through the delivery. Some of our services afterwards include our DO, Rashawn, who may help actually do some manipulation of the pelvis afterwards to begin to make sure that the mother recovers better from the delivery. And also she may do some manipulation of the baby to help the baby heal from the trauma of the birth, just the process of the birth. And so it's a package deal that goes along with that. We also have Dharma parenting classes, which again is an Ayurvedic approach to parenting, which looks at the child's constitution and really is to help parents who have more than one child, who are trying to, how do you parent more than one child, where each child's personality is completely different. And that works the same way with our cooking classes, because I know how difficult it is. Children who have chronic illnesses or need a special diet that we're really working on, and we put them on gluten-free, or we want them to be as plant-based as possible. It's really easy to tell you, well, you need to be gluten-free, and just, traditional medicine, you just get stuck there. Okay, that's great. When I was told that,
right?
Yeah, it took me 5 years to actually get that together. What does that mean? How do I organize that? How do I cook that? I didn't know how to do anything gluten-free. So I know that it takes us to hold their hand. So our goal is really to hold that parent's hand and show them how to organize their life, how to create foods that all their children will eat. We want a place where the kids can go and taste the teas that we're offering, the herbs that we're offering, the food that we think is best for them, and then to move parents gradually over time. So this is a long-term relationship. It's not go and have a physical once a year and bye, we'll see you in a year, or come in before school starts and get your asthma check. We really want to create a lifestyle where we're working to get those children to find out the cause of disease, what the triggers are for that, to get them off their medicine if possible, by helping them get enough sleep, get enough exercise. We have Heart Math, which is really a program to provide to de-stress. So we want them to have a whole toolbox of ways to manage stress, because the world is a stressful place now for children. And we want that to start at birth, because what we really want to do, instead of dealing with kids who already have these chronic diseases, is as much as possible prevent them from ever happening.
Yeah, and I'm just very interested in the community approach that you're describing. I dream of a day when we are less segmented as a people, and we have more of that sort of traditional teaching about cooking, and that movement in our lives would be more organic to us, instead of sitting in front of computers and desks all day, that children would be exploring and learning from the adults in their lives. And what I'm hearing is that that's built into your system, where, this generation of folks who may not have learned how to cook when they were growing up, because now we have two working parents in a household, or one parent in a household and they're working. Those patterns are changing a little bit now, and now you're creating a space where the movement and the food and the natural options become available and supported over the long term. I'm just so inspired by that model, and I think too, for me personally, I'm always having to support myself, right? Okay, if I want to make a new change in my life, I decide I'm going to do yoga, or I decide I'm going to eat healthier. It would be so amazing to be hooked up to a program where I got coaching or a little bit of encouragement on that path. Like, okay, yeah, awesome. You really did well on your vegetables last week, Miss Kayti. What's next? Do you deserve a salt bath now that you've had your veggies? Like, really, no, I mean, really, it means something when you get that outward support and encouragement. And so I'm really hearing that all of that's packaged.
Well, hopefully it's not just coming from us. Our goal as our office, because of our classroom space and our lessons, is that we'll end up with a group of like parents that are coming in with their children and their families to classes, and they actually will create their own support group. Because if you're going to make a change in your lifestyle, it's hard, and we're all human. We're all going to go backwards and have bad days. But if you're surrounding yourself with a group of people that want to live the life the same way you do, it just makes it so much easier. What you said is so true, and so we hope that our families also get to meet each other and create their own support group to continue that support on a daily basis, that the children play with each other, that they have more healthy role models than unhealthy role models in their lives.
Yeah, that's it. And so I see that as a midwife all the time, where I want to create support groups for my pregnant families and also for the postpartum families, because they are like-minded and they don't necessarily live in a world where other people share their same values, and at least maybe not their neighbors or their friends they grew up with or their family. And so it really is, you're right. It's so supportive to have the people that share those same values be supporting you. It's just awesome.
I think we offer a lot of services for the midwives, and one is we're doing home visits for newborns, which might be very interested to your population. But I think Bret would also like to talk to you a little bit about our vaccine program, because that's one of the things that comes up over and over again, both from parents of older children right now that are getting their kids back into school. But what we'd really like to do is talk to parents that have newborns and talk about how they feel about vaccines, and then I think Bret can talk to you a little bit about that program.
Yeah, we're putting together, we've put together lots of versions, of course, but a lot of vaccine hesitancy or a lot of questions on vaccines have come up, not only for COVID, but for all vaccines. And so many people we've heard from that just don't get support for a different schedule, or waiting on some vaccines, or spreading things out. And we embrace that. We encourage parents, Dr. Renee are both pro-vaccine, we'll tell you that up front, but we will support you in what you need to do for your family. And that's just something that you don't hear a lot in the pediatric community, unfortunately. With insurances and things, you actually get dinged, you get penalized if you don't vaccinate. So there's a financial incentive for them to vaccinate. And the vaccine schedule we think is valid. Both Dr. Renee and I think it's valid, but we also think it's valid to space things out, or to forego some vaccines because for that particular person, they just don't make sense at that time. And if you choose not to vaccinate, we will support you and tell you, what you can do to support your immune system, and how you can stay healthy, and what to watch out for, like a measles outbreak or pertussis outbreak or things like that. So we've got a system where we can help you figure out a schedule. We've got systems to help you support your immune system beforehand, to prepare it for getting an injection if you're going to get injections, and also a detox afterwards. So we're going to support the body.
So when you say for you, Dr. Bret, do you mean for the adult or for the child?
For the child.
Oh, excellent. That's amazing.
Yeah.
You have protocols in place or outlines of what to do, like for an alternate schedule and for supporting the immune system through. Can you walk us through that again? It's so important. It's really, as all of you are listening, are aware, vaccines are a really big touchstone right now. And and a lot of the families, like I've said, that we work with are vaccine hesitant, or they want an alternate schedule. I don't work with too many families who are absolutely like no vaccines. So what they're really looking for is that supplementary information and support to get the vaccines they think are important for their children.
Right.
And it's not a one thing fits all, but there's a lot of things that are common, like vitamin D, vitamin A, zinc, those kinds of things are supplements that we'll talk about. We are planning on putting on our website, there's a little spot that says a gift for you, and we're going to get a vaccine, kind of some basic vaccine information about pre and post vaccine and what you can do. But there are ways to help your body detox afterwards that you can use, things like sweating, glutathione. Then there's different things that can help your body kind of purge any additives and things that are in vaccines that people are concerned about. And again, like we said, we work on spacing them out for the kiddos if that's something that they want to do, or we'll pair them up and just.
Well, I was going to say, I think it's very hard in today's world in California to not get vaccines at all. I mean, it's not possible, which is why we really, and go to school. I mean, you can homeschool your kids, but which is why we would prefer to work with our parents that have babies, because from birth to they need to go to school, you have lots of time to spread out those vaccines and to make it an easier schedule for their bodies. And we have plenty of time to go over that immune build and then that detox after they have the shot. We also really have procedures for making the shots as painless as possible. We use Buzzy Bee, and we have supplements, bentonite clay and castor oil to put on to make the shots not sore. And that's true for adults that are getting even some things like COVID vaccine. I mean, to make things as easy on the body as possible. So it's for all of them. So it's very difficult to get any kind of medical exemption, but we can certainly, we certainly can talk about that and can tell you, how supportive we can, what we can do to be as supportive as possible.
Yeah, thank you so much. I think that's really helpful. I kind of want to turn the conversation. Dr. Bret, another midwife, as you know, another midwife reached out to me when I said I was going to do this presentation conversation, and brought up that there's that your license at the medical board is actually suspended. And you and I had a couple of really great conversations about that. And I wanted to, as you know, I wanted us to be able to have a chance to talk about that in the open, in the public, so that the public could understand what had happened and that it had nothing to do with putting children in danger. I think that's really important to make clear to the public. Would you like to speak about that?
Thanks, Katie. Yeah, give me a second. It's emotional. I am on probation. My license wasn't suspended. It was put on probation.
Oh, I'm so sorry. I'm so sorry. I missed
Thank you.
that. No,
that's okay. I mean, they put you on suspension and then they put you on probation. So the suspension word is in there in the writing. The media got a hold of it, which was even worse, and said that I was using dirty needles on children. And there were some medical record things that came up from that. It's kind of a long story. I got in trouble about 2013 for and I got put on probation in 2015 from that event when I went to the festival and got caught with some illegal substances. I was going to go out in the desert and have a good time. I did probation for that.
Can I just clarify, you were not on call, you were not treating children, this was on your own?
No, I was on vacation up in Nevada and
okay.
Out in the desert, in a camping trip essentially. But I got caught with some substances, and so I was put on probation for that and went through 4 years of probation. I went through drug testing and I went through all kinds of things. I was practicing. It got me I was working for Scripps at the time and they were great. They were very supportive in the beginning. But once I went on probation for that, you run into some insurance problems. And some of the insurance companies drop you. And so I wasn't able to see patients for those insurance companies. And so I was having less productivity, and they were a little frustrated with me. So they had me under a looking glass. I was under a microscope with them. And I was about to finish that probation when I was at home, and I found a couple boxes of old medical supplies. My partner, who is now deceased, was getting chemotherapy, and I found some old syringes and gloves and bandages and stuff. And I didn't want to throw it all out, so I thought I would bring in the syringes into the office to see if we could use them. They were needles and syringes and some medical supplies.
Obviously, they were unused and unopened.
Right. In fact, one of the boxes was completely unopened, but we opened it to see what was in the stock and what we could use, if anything. So that was where the unauthorized medical equipment came into on my probation, because I brought this into the office. None of it was ever used on a patient, but one of the MAs accused me of using a couple of the needles on a couple of kids. And there was just, it wasn't any supply that we could have used. We got rid of those. We took them out of the office. But I was accused of that. And then because of my previous probation, it was kind of he said, she said, and I couldn't really defend myself. So, I've spent 30 years keeping kids safe, teaching them, to use their helmets for their bikes, to get their swimming lessons, to not choke, teaching parents how to get the kids not to choke. So for someone to think that I would use something that was not authorized on a patient, just really, it really hurt. And it still hurts because I've been through, I've got 4 years of probation to go, and it's tough. I've got a lot of things I'm doing though. I've done some amazing medical education. I'm required to do a bunch of medical education for the board. I did over 85 hours of medical education just last year. That's as required. And I have a practice monitor. So I have someone who goes through charts. And in our practice, I never practice alone. I mean, I'm with Dr. Renee. We talk about every patient. We talk, and we've got these other providers. And so we're all working together. And I would have never done anything like that. I would never put a patient at risk for something I'm doing. We had sterile equipment. I used the sterile equipment in the procedures. My documentation didn't support it well enough. So the big thing, the big slap from the medical board was really medical records. So anyway, it's hard to talk about, but it's good to get it out in the open, because I haven't been able to say anything in all the years that this has been out there. And it's been 3 years since this happened, and the media got a hold of it, called me the dirty needle doctor or something. And it's just, it's hurtful, it's harmful. It's just.
I think it's important also to bring up that you've been seeing patients this whole time. You continue to see patients at Scripps, and you were seeing patients at San Diego Family Care, which is where we came back and saw each other. That's where I've been practicing since 2006. And many, many patients throughout this whole thing. It wasn't like he stopped seeing patients or his practice stopped or any of those kinds of things. So I think that's really important. And I think our move to a different focus is really important too, to really, again, look at health and to bring all the things that we've all learned from our practices into this practice. So
yeah, I'm really
you have to know us. You have to know us, I guess.
Yeah, absolutely. I want to turn our focus back to the there's still some big questions I want to ask you guys, but I do want to really honor Dr. Bret, your story. I want to tell you that as a midwife who also potentially could face actions against me that would not necessarily be based on my actual clinical care, but in my case, because of a radical bias in the system against midwives, that it's easy for me to see how that could have happened to you and how powerless it would make one. And I just really, my heart really goes out to you. I think that in how many years, 30 years that you've been doing pediatrics, if you were actually doing poor clinical care, we would know. And I don't think anybody with a heart big enough to want to open this massive center and invest probably everything you guys have in this incredible endeavor. I think that speaks to who you are as a person. And the fact that Dr. Renee and all the others are there with you tells me that you encourage people to want to support and love you. And so I appreciate very much you sharing your story, and I'm here to say I support you too.
Thank you so much, Katie. I
Yeah.
appreciate that. It's hard to share. There's so many details and so much stuff out there in the media. But we're really excited about PIPH. We know that kids have an innate ability to heal,
Yeah.
and to be normal, and
Yeah.
we want everyone to be able to support that. And we want to support that, and we want to get to the core problems. And maybe it's your sleep that's the problem, and that's why you're anxious, because you're up at night and you're staying up late in the morning and you're not in a good rhythm and you're not eating right. And that's why your anxiety is crazy and you're not able to concentrate. So we get down to those roots of, rather than trying to just, oh, here's your stimulant, you've got ADHD.
Yeah.
We know that the Band-Aids aren't working. We want to get down to what's your lifestyle? How is it that you're creating imbalance? Because all the ancients talk about imbalance, and that's what we were talking about with doshas from the Ayurvedic medicine. Chinese medicine talks about it as well, and your chi gets out of balance, and you've got your chakras. Most of us have heard of chakras in yoga now. That all comes out of Ayurveda. And to get all that in balance, Renee and I, we do a lot of this without probably even knowing it, but like when we pick up a baby, we're feeling their energy. I sit there and I'll work with the baby and I'll just straighten out their spine, and I'll just bend them and give them a little like arch support, and just doing that, sometimes they'll calm down. I've been called the baby whisperer by several of my parents, that I've been able to calm their child when they couldn't. And I teach them a different way to hold the baby, or just how to manipulate it, and the baby calms down. So it's really wonderful to work with parents and families and get them to get it, to get that their babies are normal, or if they're not normal, we can help them do the best that they can, that get them to their highest potential.
That's right. And I find that's such a beautiful story of just parents sometimes need that. Nobody else is saying necessarily, Dr. Bret, like, okay, watch how your baby is unfolding when we do this. And then teaching the parents how to do that and how to be with their baby in a new way. I love it. I didn't know you did that. That's so cool.
I think we do a lot with us pediatricians. We do without thinking about it, because we're around babies, all the time. And we don't realize sometimes that parents don't realize that, but I think we're so conscious of it now in our practice. With us, you're going to get an hour intake, if not. Yesterday, we were at a patient for an hour and a half at their home. And we talk about everything.
Wow.
We're talking about your diet, your sleep, your activity, toxins in your environment. So we're just there to really get as good and a thorough look at your life to help you pick what ones that you want to work on too. We also come from the parents' point of view about what's the one area that you want to focus on, because we know you can't do it all at once. Right. You're not going to suddenly change your whole life and become this, super buff star and eating, paleo or whatever. It's you're going to take one step at a time, or you're going to do a couple of things and see how that works. And we'll work with you through that.
Yeah, I think we want to be your partners in your care. And I think the other reason we really started this is there is nothing like this in Southern California. There are several integrative centers for adults. So we know that there are adults out there that probably have children that want this kind of care for themselves. But if they want it for their children, it just hasn't been available. Could any mother individually find all these different practitioners and vet them and get them and then drive all over the city to do this? Yes. But what we bring to the table is everything under one roof. And then we're coordinating that care. This becomes truly your healthcare home. Not just a medical home, but a healthcare home that's integrated, that really brings all these different parts together. And then with the parent as the pilot. So we're that partner. Our goal is to provide you with the education and the knowledge, but you've got to guide the ship. You're the one that's home every day taking care of that child, not us. We're there to support you however we can do that. And I think that that's really a very unique perspective in pediatric care today.
Dr. Renee,
we're kind of co-pilots.
I would love it if you would just walk me through a typical visit. What's different about a visit with PIPH compared to a standard pediatric office? And could you just walk me through how a visit goes?
Well, the first thing is when a patient calls and we set them up for an intake appointment, unless they want a specialty appointment like healthy mother, healthy baby, or they want vaccine, they get an intake. So the first one we're going to do is to get and that includes a very comprehensive physical, right down to for the mother, for the child. We want the mother's pregnancy information, the delivery information, really the status of the mother's health during her pregnancy, even her past history, dad's past history, all they bring that to that baby. Then really very comprehensive history. And then we sit down and do a complete exam, take a complete history, do a complete physical. Then after that's done, we compile that into we put it all together and we sit down and have integrative rounds. And all of us together then sit down and look at that and create a care plan. That may have different recommendations, like we think that they might need heart math, or we recommend that they are in the salt booth, or we recommend that they get, acupuncture assessment for some acupuncture treatments, or whichever is the best practitioner. And then we bring that care plan to the parent and we say, these are our recommendations. How do you feel about this? What would you like to go forward with? And then we put that care plan into action as the parent decides what they want to do. And that's very different from coming into a traditional Western medicine where I'm going to do an exam, say, here's your diagnosis and here's your prescription. Thank you, goodbye. And let me know if you don't get better. This is an ongoing support system that we're doing. And we're going to let you know what to look for if we're asking you to get better. You're coming to us for a child with a chronic illness like ADHD or autism or obesity or depression or any of those kinds of things. We're going to say, let's implement this, and then we're going to measure it. Let's see you in a week and see, are you better or are you not better? Do we need to change this plan? Is it not working or not working? If we're going to put a herb or a supplement in place, first of all, we're not going to just take everybody off the meds that they're on. We would probably add some things, lifestyle changes, and then we'd slowly try to wean them off the drugs that they're on if we can. And so after we maybe look at what their triggers are, I think a big thing for a lot of these kids is to find out what the triggers are. If they have a chronic disease, what's bringing on their attacks? If they have asthma or if they have an autoimmune disease, what's really triggering those attacks? And then really working on that with the family so they can lead the healthiest lifestyle that they can.
I may have mentioned this in our other call. I am currently surrounded by a lot of teenagers in my life, 16, about 14 to 19 years old. There's, I think, 10 of them in my life right now. And anxiety comes up a lot. Not as much depression as anxiety, and pretty much all of them. And what I'm hearing is that sending them to you all would create an opportunity, like you're saying, for someone besides myself to say, hey, let's, how often are you getting out to exercise? What kind of exercise do you like to do? And then the supplements, which I really don't know much about supplements that would be good for teenagers or kids, the supplements. And then, like you're saying, the follow-up. Oh, okay. How did that work? Is that working for you? And then, like, again, going back to my own experience, the coaching, the personal, not just accountability, but encouragement. Oh yeah. Okay, good. We're seeing look at that. Are you noticing that you're feeling better because of the things that you're doing? Wow. That's awesome. Look at you.
And I think that's so critical. I think that, and it's very different. One of the reasons we need to be so in touch with the teenagers is that talking to a 12-year-old and the kind of issues that a 12-year-old might be having, now the anxiety may be there, but there may be a lot of other issues causing that. Very different than, say, an 18-year-old. And I've just seen both of those in the last 2 weeks. And they have very different needs and very different issues, but both of them need a lot of support. I think teenagers probably need the most support. Parents of toddlers and then teenagers themselves, because they don't feel normal. They don't know what's normal. And they are coming off a really, really challenging year. This last year with homeschooling and insecurity and parents who've lost jobs, everybody in the same house together, schedules that are disruptive have just created so much free anxiety from everybody. So one of the things I think is really making sure people are focusing back again on what things that are going to make you feel better, like sleep. Like this, I was really happy, this child who was also depressed and all kinds of other things. I asked her, I said, okay, here's this whole list of things that you've told me that are wrong, but I don't have a magic wand, and we're not going to change everything all at once. You can't, overnight. So I asked her, what is the thing she wanted to work on the most? And the thing that bothered her the most, I thought it might be her acne. No, it was her sleep, and not her depression, not her acne, her sleep. And I was like, that's great, because if I can work on your sleep, this other stuff will also go away anyway. Your acne will get better. Your depression will get better. So I was thrilled that that's the thing she wanted to work on, because we're going to approach her with whatever is the issue that is most concerning to her. So teenagers in particular, and that's going to change. What's bothering her today, in 6 months, it's going to be something completely different. It's her best friend who, snubbed her at lunch. It's going to be something completely different. So I think that giving them tools, also helping them recognize their own feelings, recognize when they're feeling anxious, and giving them tools so that they have control. I think part of the issue this last year is feeling like nobody has control over anything. So the one thing you have control over is your own body. So, and teenagers often don't feel like they have control over that either. So I think that, helping them, giving them tools, I think are really, and then just encourage them to stay on track, because everybody gets off track.
I don't know about everyone else who's going to be watching or listening to this, but I am just so touched by everything you've said. And there's something also about the way both of you speak, Renee and Bret. I feel that your way of speaking makes me want to keep listening, which is a real gift. This just makes so much sense to me as a practitioner, but also as somebody who's seeking health for our kiddos. We happen to have a household where both our kiddos are gay or queer, and we're wondering if you guys have supported families who have kids who are queer or transitioning or questioning or even trans. Can you guys speak to any experiences that you've had with that?
Yeah, I think both of us have taken care of children who are at least questioning, if not. I've taken care of several kids who are trans at Steve Family Care. I wasn't their, I was their regular doctor, not their specialist. There are certifications and things that we can get in those areas, but we don't have those. But we are always questioning kids about their sexuality, usually away from their parents. But I've had kids as young as 5 who I had a set of twins. One girl was just the cutest little princess, and the other one was just the biggest tomboy. And even at the age of 5, she wouldn't wear a dress, a skirt, anything, only pants and a shirt, and wanted to look like a boy, and thought that she was a boy. It was interesting because she grew out of that, but I had conversations with her and with her mothers privately just to kind of feel that out, to see where are we, how can we support her? What do we need to do? What do we need to be watching out for when she gets old enough to actually make a decision if she wants to go that way? Mm-hmm. How do we support her, and how do we make sure the parents on board early so that the parents aren't blindsided by that or anything else? And luckily the parents were really supportive, and it actually seemed to resolve. But we love that. We love supporting parents and families. Maybe it's a gay couple who has adopted kids. We totally support the whole LGBTQ community, and we've got resources for them. We are open to listening to what they have to say. We'll help them figure out where they're going and what they need. And it's beautiful. It's pretty beautiful.
That's what I was hoping you'd say. That's good.
Yeah. Well, I'm gay myself.
Oh, you are?
I am.
Oh, I didn't know that.
We didn't have that conversation. We talked about partners and stuff, but yeah, I have my partner, and unfortunately we don't have kids. I'm getting a little beyond that age, but this is where I put all my paternal instincts or maternal instincts, depending on how you want to look at it.
Beautiful.
Yeah.
Wow. Renee, do you have kids?
I do. I have 2 children and 5 grandchildren.
Oh my goodness. Okay.
They're wonderful.
Yeah. I have a big family. My daughter's a nurse also. So
oh my goodness.
A lot of healthcare in the family. So yeah.
Renee, tell me again how long you've been practicing with children?
Over 40 years.
Over 40 years. Wow. Yeah. And again, go ahead.
Like 70 years between us, I think. I've been 30, she's been 40. It's a lot of experience. We've seen a lot.
A lot of experience. Taking care of a lot of children. I feel like I've dedicated my life to helping other women raise their children. And I think that's a good thing to do. Or not just women, families, dads, parents, gay families, I mean, we've had them, I've had them all in my practice, and it's an honor to be a part of somebody's family, you know, to be allowed to help them, to educate them, and to provide some of the experience and wisdom that I've had of this 40 years of being there. But I feel like this practice is really the culmination of both Bret and I, all of our experience, and then looking at where is this gap? Why is there still a problem? Why, after all of these years, is Western medicine not, you know, solving the problem? And I heard somebody talk about the fact that Western medicine was really good. And I just want to use this analogy. He said there was two kinds of medicine. There was vertical medicine and horizontal medicine. And if you were horizontal laying down, Western medicine was great because you probably needed surgery, trauma. You had something that really Western medicine is fantastic at resolving. And that's great. But if you're horizontal and you're up and you're still moving, you probably need something other than Western medicine, because we're not very good at supplying. Western medicine is not nearly as good as solving chronic disease, dealing with that. We just don't, there's just not a lot of good things in the toolbox by itself to help. And they've been very slow to acknowledge the science behind lifestyle changes, how much diet itself and diet alone, which is key to other traditional philosophies, Ayurveda, Chinese medicine. Diet is everything. Diet is food. And it's only
Food is medicine.
Food is medicine. Only in the last 5 or 10, 15 years are we seeing the science in Western medicine validating a practice that's been going on for 5,000 years in the rest of the world. So I think that that's really, you know, it's been very slow, and it's something that's important for us. But I think this practice really is, you know, trying to fill that gap. And along with that, I think we want our patients to have insurance. Insurance is absolutely required for when you are horizontal. So you have to be prepared for urgent care or a hospital visit or cancer or something else that really you're going to need your insurance for. But in today's world, especially with all of the families that have lost their jobs, a lot of people are paying a very high deductible insurance. And the services that we offer are really not covered by insurance anyway. So we wanted to make that as affordable as possible. And our membership plan really allows this monthly payment to get all those visits over a year of time and to have all that covered in a very inexpensive way. It's, you know, $250 a month. You know, it's less than many of the other things that you're paying for, even your phone. Those things are very expensive. And yet we offer that, and we feel like we put it together in a very inexpensive way and allowed that to get covered, because it's mostly not covered. And we'll use your insurance for things like your labs, for the labs that are covered, for your vaccines, because insurance pays for vaccines, those kinds of things.
I want to
provide
go ahead, Bret.
Go ahead. I was going to say we'll provide a super bill that you can submit. If you have a PPO plan, you might be able to get us as an out-of-network provider. Right. But that's up to you to take care of that. And of course, we'll accept like FSA and HSA plans and things like that as well. So there are ways to use what your resources are already.
Yeah, I think for me, if I think about all that's included and what health outcomes I want to get, I just know that I'm not going to be able to get the health outcomes that I want, certainly not from a traditional doctor. And I'm hearing that I'm just getting it in this part of the conversation, that I could actually potentially get that with working with y'all. It's really, really exciting. And I think you're right. I mean, if you compare $250 a month to what I'm paying Kaiser for incredibly high deductible healthcare, what you're describing is something that has a lot more value for actually a lesser cost than what I'm paying Kaiser every month. And I want to say, this is my tout to the world. I think we're moving in this direction. I think in this country, we've lost a lot of information as we migrated from other countries and maybe lost traditional cultures. At least in my culture, we've lost a lot of traditional information. And I think we're moving, as Dr. Bret sort of said in the beginning, towards being able to integrate the Western medicine that does a good job at some things, and the other kinds of information that we now have access to from around the world on how to heal the body for chronic issues, like Dr. Renee was just saying. And I think people are, you guys and us midwives, I think we're on the frontier of the change. I think that we're groundbreaking in that, okay, we'll support you where we can with the Western, and we'll use those techniques as we can. And we're also relying mostly on other ways of helping each other, talking, herbs, food, community support, the things that used to be integrated to how we lived and now are a little more segmented. And now you're trying to bring those all under one roof, which I think is just phenomenal.
We're pretty excited. We really are. There's a couple integrative centers, like UCSD has an integrative center, but it's all adult. Scripps has an integrative center. It's mostly cardiac care. They do some pain relief and stuff, but Kaiser even has an integrative center. But again, nobody's doing pediatrics, and it's such a good place because kids respond so well to natural treatment.
Mm-hmm. Well, and Rady's had
really
an integrated center, but it's not working very much. And it was mostly for managing pain control in children. But we're looking at children that are living from surviving cancer and who now want to change their lives. Their parents want to change their lives because they don't want those cancers to come back, or who have really all kinds of chronic diseases that are not getting necessarily living their best life. Or getting better under the care that they're getting. So we provide that supplementary care. In addition to, we hope to be, basically the medical home for, a group of families that want to have the kind of pediatric care that we provide. And we provide, of course, we follow all the American Academy of Pediatric recommendations for well child visits and vaccines, all of that kind of stuff. We didn't get rid of the traditional Western medicine. We're just surrounding it with, we're just integrating it with a bunch of other care to really provide what we think is the best evidence-based care for your family.
Beautiful. Hey, you guys, the sign behind you can be a little hard to read. Bret, can you put up a thing so people can clearly see how to get a hold of you?
Sure. Can they see the chat too?
They cannot.
They cannot. Let me pull up this real quick.
So
I was going to post stuff in the chat, but I'll.
Put up that card we looked at earlier.
Yeah, I'm pulling that up now.
Perfect.
To shut that down. This is so what people need to know is our actual office here it's in Rancho Bernardo. It's right off the 15 at Rancho Bernardo Road. You can actually see it. It's right next to the church in RB if you know where that is. But this is a way to reach out to us. And Dr. Renee is Dr. Renee at piph. It's the same. Our website is on there. We are not open at this facility yet. We are doing telehealth and virtual visits. We'll do home visits. This office should open September, October of this fall. We are in construction. We've got permits into the city. We've had many delays, but we've got our team together. Well, all anxious to get this going now that COVID is wrapping up. Things are moving a little more quickly. So we are excited. We've got everything coming. So this is how you can reach out to us. Give us a call, give us a text if you're interested in setting up. Either we can see you for like a 15-20 minute visit with the two of us or one of us to just meet. If you have specific questions or, my child's got this, can you deal with this or whatever, we'll be glad to meet with you just for free to chat and catch up and get to know each other one-on-one. Or you can schedule intake. We'd be really happy to do that.
Yeah,
so is that enough, do you think?
Yeah, for the midwives, I think. For the midwives, I think if you want to make a referral test, we'd love to meet your family before they deliver during their pregnancy so that we can kind of do some of that intake information that we think is so important. And then we're ready to set up however they want us to, whether they want a home visit after the delivery, so they don't have to bring the baby in or, however they would like to arrange that. So
that's amazing.
They can just, again, you can call us so we can set that up, but we would prefer to be involved with preconception. And if they want to go through, like actually add the program of massages and diet and stuff that goes along with the Happy Healthy Mother Baby program, they can certainly do that too.
Beautiful, beautiful. And the Happy Healthy Mother Baby program, is that up on your website?
Yes, it is. So they
Awesome.
can definitely go and get all the information about that and the cost for that up there also. And I think we also will be happy to send the membership fee package to anybody. And like Bret said, we can do that as part of an introductory call if they just want to call and just have a brief 15-minute, get to know us kind of a call.
I appreciate that. Yeah, I'm sure it helps people to get to have this kind of interaction with you where like I'm getting to have, and it's very valuable. So thank you for offering that. And I'm going to talk to our daughter about it. I really appreciate your time today, you two. Thank you just so much. I enjoy talking to you so much. And yeah, I'm excited. I hope that this information will get out to a lot of people. I will certainly pass it on to all the midwives because it would be amazing for them to have signed up and know where they're going. And they're going to continue to have so personal, comprehensive, continuous care through the rest of their kids' lives if they stay in San Diego. So yeah, thank you.
Thank you so much for having us.
It's a pleasure. It's really nice to talk with you again.
Yeah.
And we look forward to seeing you soon.
Yeah.
Thanks for having us on. It's really an honor to be here.
It's cool, isn't it? All right.
Yeah.
Yeah. I'll
That's
talk
awesome.
to you guys soon.
Thank you.